Okay, perfect. Ready to get started?
Let's do it.
We're taping this between both women's soccer games today,
The National Women's Soccer League is in the middle of their playoffs.
and DC's moving forward. So, we're excited. We're ready to see what they're going to play. And here we are smacking between both games on this lovely afternoon. So we thought, let's hop in, record, and make it back out in time for the next game. So we got to get this going. We got to get this going.
Rolling forward, Dr. Sister Science Facts.
So welcome to the Rolling Forward podcast.
I'm Dr. Stephanie Rolin.
I'm Dr. Alicia Rolin.
I'm a psychiatrist. I almost forgot that. I'm like, what do I say now? We took a week off and I can't remember. I'm a psychiatrist.
And I'm a pediatrician.
And we're both part-time clinicians, part-time researchers, and we do this podcast as a way of trying to address some of the health noise that's going on in the room, focusing on facts versus fiction.
And again, this is not medical advice. The views here are our own, but it's just to help people understand some of the big rapid changes that are happening right now with our government.
Exactly. So here we're sharing the facts, the science as it applies generally. And then if you want to know how it applies to you personally in your own situation, because we're all unique and the needs of our families are all different, make an appointment with your doctor and bring it up.
Rolling forward, Dr. Sister Science Facts.
And today, drum roll.
Do.
That was a trumpet, not a drum roll. We're going to need a drum roll like a... We are going to be talking about the very early newborn phase. Remember that?
I do not remember my newborn phase.
I meant Marvel's. When Marvel was tiny. When my daughter came home from the hospital, she was under 6 pounds and she was so small that we were afraid just all the time, the way that you are when you're a first-time parent holding a newborn. And, you come home from the hospital, you're holding your newborn, you practice swaddling on the doll they give you at the hospital, so you're ready. They give you the adorable little tiny hat that your child does not want to keep on, but you just keep trying to do it. And even before you come home, your child has a series of health checks, screenings, exams, and vaccines, right?
But what if that first vaccine was optional or delayed?
And that's the discussion that's happening right now in health news, because the Federal Vaccine Panel, known as the Advisory Committee on Immunization Practices, or ACIP, we have a few episodes about ACIP if you want to go back into our archives and look them up. And we're going to need like a more official rewind sound. ACIP decided to delay a vote about delaying the first dose of the hepatitis B vaccine for infants. So in this episode, we're going to talk about what this all means, why it matters, and what you need to know right now. So let's get started. Here's this week's episode of the Rolling Forward podcast.
Rolling forward, Dr. Sister Science Facts.
So, a delay of a delay.
I mean, really, when you start to think about it, you're like, wait, what are we even talking about?
But here's the latest. So in their September 2025 meeting, ACIP delayed a vote on changing the longstanding recommendation that all infants in the U.S. receive the hepatitis B vaccine within 24 hours of birth. So we call it eyes and thighs. You get the little ointment on your eyes and the vaccine in your thighs.
I mean, eyes and thighs, I'm here for it. And the reason that this is because the CDC currently recommends that every infant receive a dose of the hepatitis B vaccine at birth, regardless of the maternal hepatitis B status.
The proposed change would allow a delay in the hepatitis B vaccine for roughly 1 month for babies that are born to parents who test negative for hepatitis B. Although some sources are reporting that the recommendations might actually delay the vaccination until age 4.
And in considering this, ACIP members cited insufficient evidence and ambiguous wording in this proposal as the reasons that they wanted to postpone the vote.
So right now, nothing has changed, and this birth dose policy is still in effect for now.
But it's worth keeping our eyes on because it's not just scientists and families that are watching. If you recall, Senator Bill Cassidy, He's a senator from Louisiana who is also a medical doctor who specializes on liver disease. And he has long worked on hepatitis B prevention. And he's publicly praised ACIP's decision to hold the vote because he warns that any delay in providing the hepatitis B vaccine could risk newborn lives. And he believes that vaccine policy should stay grounded in science, not politics, which is interesting considering that he was the deciding vote on
He was on the HELP committee.
the HELP committee, healthcare, education,
Labor pension?
labor, pension.
Let me look that up.
He was the deciding vote to move RFK Jr.'s nomination as HHS secretary forward.
Health, education, labor, and pensions.
He had a big back and forth with RFK Jr. during the confirmation hearings about the hepatitis B vaccine and really trying to pin RFK Jr. on supporting the hepatitis B vaccine. This really is something that Senator Cassidy, is focusing on. And he's already tweeted that as a liver doctor, I know how devastating hepatitis B can be. And I commend ACIP for pausing rather than making a change that could have endangered babies. So let's just take a moment and talk. Why do we give this vaccine at birth? Why is this potential change worrying Senator Cassidy, physicians, and us so much?
Infants infected with hepatitis B at birth face about a 90% chance of developing chronic hepatitis B.
That's a high likelihood of something that sounds like a chronic infection. So what does that mean?
Chronic hepatitis B can lead to liver cirrhosis, liver cancer, and need a lifelong monitoring and treatment. And that's a really, really huge burden for something that is entirely preventable with a vaccine.
And before the hepatitis B vaccine became routine for newborns in the early 1990s, an estimated 30 to 40,000 U.S. children got hepatitis B every year. And about a third of these cases happened right at birth or in early childhood. So more than 10,000 babies, newborns, a year getting hepatitis B, 90% of whom are going on to get chronic hepatitis B. Back then, when youth considered all new hepatitis B infections, kids made up 25% of them.
After the universal newborn vaccine was introduced, those numbers fell by more than 95%.
Wow, 95%.
And today, there are fewer than 400 pediatric cases of hepatitis B reported each year.
So it sounds like the birth dose, it's not just this routine hospital task, it's actually one of the biggest public health success stories of the last generation.
So successful.
So, Alicia, how does this prevention work in practice in the hospital setting?
So in practice, individuals that are pregnant undergo certain tests. And one of the tests that they get is a blood test to test if they are hepatitis B positive.
And if a person is hepatitis B positive, their newborn should receive both the hepatitis B vaccine and hepatitis B immunoglobulin within 12 hours of birth.
And for individuals that are pregnant who test negative, we still recommend giving that hepatitis B vaccine within 24 hours of birth.
And then the series continues with additional shots available around 1 to 2 months and 6 to 18 months. That's the typical schedule.
So in short, you get one within 12 to 24 hours of birth, you get follow-up doses, and you get super strong protection to help prevent chronic hepatitis B.
It sounds like this is pretty routine. We've had it for more than 30 years. We see a large success with plummeting rates of chronic hepatitis B among kids. So if this has been so effective, why are they considering a change?
So, Secretary RFK Jr. has been really focused on revisiting the childhood vaccine schedule.
I've heard this. I've heard that somewhere. Where did I hear that? Was it on this podcast? Yes, I think. Yes. He's obsessed with the idea that Americans receive too many vaccines. Too many. It's just too much.
Too much.
We need fewer without actually any scientific reason or consensus around it. He's just been really focused on the raw number of vaccines.
President Donald Trump has specifically said that there's no reason for newborns to get the hepatitis B vaccine, as it is a sexually transmitted disease, and instead children should wait until they're about 12 to get this vaccine.
I don't even know what to say about that. It's so concerning because While the majority of infections are transmitted from parent to child at or around birth, kids can become infected from environmental sources, especially if someone in their household or a healthcare setting or in their school is carrying the virus.
The birth dose acts as a safety net. It provides super early immune protection against both maternal and non-maternal exposures.
And there are a lot of concerns about delaying the shot, even if it's delayed by just a few weeks.
Public health experts have put out a number of warnings. First, screening gaps and late infections can leave infants unprotected if the shot's delayed.
And second, delaying the shot until there's an outpatient visit raises the risk of missing the first dose entirely, which will impact overall coverage. There was a study done that found that infants who got the hepatitis B birth dose were much more likely to finish all recommended early childhood vaccines.
Third, equity matters. Universal at-birth dosing reduces disparities tied to access and follow-up care.
Because of these concerns, ACIP decided to hold off for now, keep the status quo, and not push a change forward.
Meanwhile, the Vaccine Integrity Project says it's reviewing national immunization data and plans to publish a full report later this year, looking at how vaccine schedules are set and communicated.
Basically, this conversation about the hepatitis B vaccine, sure, it's about one vaccine that babies get at birth. But this debate isn't happening in isolation. It's really part of this bigger national conversation around vaccine policy, transparency, and trust.
Mother, should I trust the government?
So, for newborns, timing matters. If you're expecting now or you're taking care of a little one at home, let's give our listeners some idea of what they can do right now.
1. Have early conversations. Talk with your OBGYN, talk with your pediatrician about your screening status and getting tested before the baby is born. Ask, will my baby get the hepatitis B vaccine before we go home from the hospital?
And if you're currently speaking to different pediatric offices looking for where's the right place to get care for your family, one of the questions you should be asking about is whether they're going to be following the CDC's current recommendations. ACIP did not vote on delaying, and the CDC recommendation remains to get the hepatitis B vaccine at birth. If a pediatrician you are speaking with suggests waiting, ask them why, and ask them how you will avoid missing the doses.
And then keep records. Keep note of when doses were given, how many follow-ups, and when your next doses are due.
So, in short, today the recommendation stands. All newborns should get a birth dose of the hepatitis B vaccine within 24 hours of birth. However, the policy debate is continuing. But despite this policy debate, Alicia, what doesn't change is the science. And the reality is that the science behind protecting infants from hepatitis B is robust and clear.
As parents, you don't have to wait. You can talk with your clinicians, you can ask questions, and you can keep your child's vaccine schedule on track, even if someone is pushing for a delay. And that's our show for today.
Rolling forward, Dr. Sister Science Facts.
Thank you for listening in. I'm Dr. Stephanie Rolin.
I'm Dr. Alicia Rolin.
Please reach out to us on the socials. If you've enjoyed this, rate us. Give us a 5-star rating. We'd love that. Write a review. Share it with a friend.
You can reach out to us by email. Our email is rolin_show. That's ROLIN_show@gmail.com.
Or on any of the socials. Thank you for listening.
Rolling forward, Dr. Sister Science Facts.
Leave us a 5-star review. Share this with a friend if you found it helpful. Share with your doctor. Maybe we know them.
Maybe we know them.
Maybe, probably we don't. Maybe we do.
It's a small community.
It's still, yeah, it's a small community. Smallish.
Smallish. Until next time, we hope it's hepatitis B free.
Oh, okay, good.